We here at the Illinois Chiropractic Society hope you are having a fantastic day. Many of you are receiving letters from a particular managed care organization regarding their Medicaid product. And for a lot of you, that's new. So let me back up and give you some quick history on Medicaid and managed care organizations. Back in 2011, Governor Quinn signed into law a new Medicaid revamp, if you will, that was requiring that at least 50% of those covered under Medicaid are covered under MCOs by 2015. We're actually at the 60% mark. And now many of you may be asking, what do we even care about Medicaid because of the coverage levels for chiropractic? Well, here's why it's really important for us as a profession, really for all of healthcare, but for chiropractic especially, is we're not talking about a small portion of the population. We're actually talking about 25% of Illinoisans. Well over 3 million Illinoisans are covered under the Medicaid system. And so by discarding that system in its entirety, then we're ignoring a population that so desperately needs your help and needs the care that you provide in your office. That is why the Medicaid population is still important to us and why we continually pursue and advocate on our profession's behalf in the Medicaid system, really working to get full inclusion in parity with other providers. And that's a constant conversation. We're running into continual challenges because of the uncertainty of the Affordable Care Act, because there's a lot of things in the Affordable Care Act that are Medicaid related. And so we're running into challenges with its uncertainty and also with a challenging budget situation here in Illinois, the fact that we don't have one this year and we didn't have one last year, and quite candidly, we're not certain when that's going to change. It very well may be 2018 before we see a budget. And so what we're running into is, okay, so what do you do? When you look at this letter, what does all this mean? Well, what happened was Governor Rauner stepped in and said, okay, we're going to make some new changes to the MCO system for Medicaid. And what had happened is there was a lot of specialty groups. They handled small portions of the population. Maybe it was just those who were both disabled and Medicaid. So maybe they had Medicare, Medicaid as well as kind of a combination. And so they handled just those. They called them duals. And others handled certain specific geographic areas, and because there was only about 12 counties or so that were covered, which left 90 counties out of the MCO lurch. And so now what happened is Rauner stepped in and said, we're going to move to a statewide all-inclusive system. So we're going to do away with the specialty systems that handled particular conditions or particular situations. Instead, we're going to move to a smaller number. Currently, by the way, it's gone down from 30 providers, 30 MCOs, all the way down to about 12 in our current system. With the new Rauner system, we look to see that shift to 5 to 7. And so where the Governor Rauner plan has moved us to is really everything's going to be statewide except for possibly one or two plans. Those one or two plans will just cover Cook County with the vast majority of the Medicaid population. Again, remember, we're talking about over 3 million covered lives in Illinois, but with about with the vast majority of those up in that Cook County area, they may have some specialty groups for that particular region. Every other system is going to be statewide. So for those who are receiving letters, it's new because you haven't been a part of the MCO system, but know that 60% currently of the Medicaid system is really covered under the MCOs. So this isn't new to the system as a whole, it's just new to your particular geographic area. And I would anticipate, because the RFP process and some of the decision making is going to occur over the next 2 months, that you very well are going to see many more of these letters as these MCOs begin to really attempt to expand their networks and demonstrate that they can cover a full array of services. And we're going to continue to advocate in the Medicaid system to ensure that to move and advance the chiropractic model forward, because we know that the care that you provide your patients has financial efficacy, is important to a patient's health, and is critical to the overall healthcare system. And so we're continuing to advocate in those areas. But as you receive these letters, we would encourage you to evaluate them like you would evaluate any other network. Know that no coverage is going to change. Most likely, we don't believe there's going to be any deviations away from the current Medicaid system, which is 19 years of age and younger and adjustment only. Now, our advocacy efforts are moving towards full inclusion for full scope. As long as it's a service that's being paid for another provider, it should be paid for to you and on an equal basis as the other provider types. But in the meantime, evaluate the system based on the current marketplace, which is again 19 years of age and younger, and adjustment only. And so that's what's going on. That's why you're receiving that letter, or the letter you may have already received, or the letters that may be coming into your mailbox in the next few weeks as these MCOs begin to expand their networks. I hope that helps, and we'll catch you all next week. Thank you.